This video will address 6 diseases that cause dementia. In addition, we will go over some diseases that can be mistaken for dementia. I recommend watching my other video that answers the question, what is dementia? The link will be in the description below. Now let's move on to some of the causes of dementia. So, diseases that cause dementia are diseases that degenerate the parts of our brain responsible for cognition. First, we have Alzheimer's disease, which accounts for 60 to 80% of the cases of dementia. Next, we have vascular dementia, such as stroke, frontotemporal dementia, dementia with Lewy bodies or dementia of Parkinson's disease, and normal pressure hydrocephalus, and Creutzfeldt-Jakob disease. As a heads up, just because someone has one of these diagnoses, it doesn't mean they don't have or can't get the others. Organizing the information was a bit problematic, and so I'll go over each of the 6 briefly. Let me know if you're interested in learning more about any one of the diseases in particular. For each disease, in order to organize the information, I will discuss the risk factors and signs and symptoms, including which symptoms present initially and which symptoms present over time. Let's read this together. For Alzheimer's disease, the risk factors are being older than 65 years old, family history, and Down syndrome. For signs and symptoms, the patient will experience a gradual decline in cognition. Initially, the patient experiences memory impairment, executive function impairment such as staying organized by planning events, and insight impairment. Over time, the patient will experience behavioral and psychological symptoms, and sleep disturbances which consist of getting to sleep and staying asleep. I made this a different color because sleep disturbances can present initially as well. A common error people make is believing that Alzheimer's disease is the same as dementia. Alzheimer's disease is just one cause of dementia. In other words, just because someone has dementia, it does not mean they have Alzheimer's disease. Next, we have vascular dementia. Let's read this together. The risk factors are being older than 65 years old, stroke, high blood pressure, and diabetes. For signs and symptoms, the patient will experience a stepwise decline in cognition. Initially, the patient experiences executive functioning and insight impairment. This means that the patient's memory is unchanged, but there's been increased difficulty with staying organized, and the patient's more likely to have vascular dementia as opposed to having Alzheimer's disease. Over time, the patient will experience behavioral and psychological symptoms and sleep disturbances. This is just like Alzheimer's disease, which is why seeing your doctor annually is important, because over time, differentiating between Alzheimer's and vascular dementia becomes more difficult. Next, we have frontotemporal dementia. Let's read this together. The risk factors include stroke and head injury. For signs and symptoms, the patient will have a more abrupt or sudden presentation. This is due to the nature of the risk factors being sudden events. Initially, the patient experiences a change in personality, demonstrated by behaving inappropriately. Over time, the patient will experience difficulty with word finding. Next, we have Parkinson dementia and Lewy body dementia. I'm going to start with the signs and symptoms, which come on gradually. For Parkinson, initially, the patient will have difficulty moving. They will feel rigid, experience tremors while staying still, and have trouble walking. Over time, they will have sleep difficulties, visual hallucinations, decreased alertness, and difficulty with body coordination. The difference between Lewy body and Parkinson is that with Lewy body dementia, any of these symptoms can occur initially. Regarding the risk factors, there's family history and being 40 years old or older. One interesting point that I want to make is that smoking decreases a person's risk of developing Parkinson and Lewy body dementia. But please don't use this as an excuse to smoke. Next, we have normal pressure hydrocephalus. We don't know why people get this, but patients will have memory impairment, difficulty walking, and difficulty holding their pee. For this last disease, I want to start by noting that Creutzfeldt-Jakob disease is extremely rare, only around 6,000 to 7,000 cases throughout the world each year, around 500 of which are in the United States. We are still trying to understand how people get it, but we know you can get it from consuming diseased beef or being exposed to contaminated body tissue. For the signs and symptoms, the patient will have a rapid decline. The patient will have memory loss, excessive sleeping, difficulty walking, and unfortunately, patients die within a year. There is no treatment. As an example of causes I won't go further into, we have alcohol, infections, and head injury. Now we will discuss dementia. Impostors. There are 3 diseases that can be mistaken for dementia that your doctor will want to rule out. These include delirium, mild cognitive impairment, and depression. Keep in mind that just because a person has depression, for example, it doesn't mean they don't also have dementia. The difference between delirium and dementia is that in delirium, the neural function is impaired instead of a foundational neural structure. The best analogy I can think of is when someone stands in the way of the TV remote. The remote works, the TV works, but something's interfering with the function. The most common causes are medications, both prescription and non-prescription. These include pain medications, psychiatry medications, and calming or sleep medications such as benzodiazepines. Illicit drugs are a common cause as well. Next is mild cognitive impairment. This diagnosis is used when the patient does not meet the criteria for dementia. Usually, that criteria is that the patient is still able to care for themselves. Last, mild cognitive impairment increases a person's risk for developing dementia. There are clues that tell us the patient has depression, and the main one is patients can recognize their own memory loss. People with dementia often cannot recognize their own memory decline. Now, labs and imaging. Labs and imaging tests are usually not done for dementia. That's because the mini mental state examination is sufficient for making the diagnosis. Rather, tests such as blood work listed here are to ensure that the decreased cognition is not due to delirium. There are other tests such as lumbar puncture and electroencephalogram, otherwise known as EEG. These are done in situations where the patient is younger than 60 or experience a rapid decline in cognition. Doctors will collect images of the brain if the patient has neurological symptoms such as the ones listed here. Here are the possibilities from the brain imaging results. Certain brain regions are vulnerable to different disorders, giving us hints. For example, Alzheimer's disease affects a brain structure called the hippocampus. We can see a decrease in brain size or volume. Problem is that a decrease is seen in normal aging as well. However, we see a faster decrease in mild cognitive impairment and an even faster decrease of dementias. Last, we can also see signs of poor blood flow. This would be expected in vascular dementia or stroke. When it comes to CT scans or MRIs, doctors prefer MRI. The reason is that MRIs are more detailed and avoid radiation. Doctors will use CT if the patient is claustrophobic, timing is a factor, such as in strokes, or if the patient has metal in them, such as a pacemaker. There are genetic diseases that cause dementia. However, doctors won't do genetic testing because the diseases they cause don't have a treatment anyway. We also have advanced imaging tests, such as Positron emission tomography, PET. These tests are still in development and are currently being used for dementia research. Now we've come to treatment, which is complicated. Treatments will depend on the specific cause of dementia. Regardless of the cause, people with dementia need help with their daily acts of living. That is why social support is important. This concludes the video. As always, thank you for watching. Comment below on any medical topics that you are interested in learning more about. Also, please feel free to leave any feedback on how these videos can better serve you.